After actor Luke Perry's death yesterday, many started to question how someone his age could have had a stroke.
Perry was 52 years old, but experts say stroke does not discriminate. Let's send things over to Howard Dashevsky.
Yeah, Bridget, Kathy, thank you very much. Joining me now is Dr. Kazuma Nakagawa, a neurologist from the Queens Medical Center. And we want to talk about stroke. And first of all, it shouldn't necessarily be shocking that anybody of any age suffers a stroke, true? Because it can happen unannounced to anybody. It doesn't discriminate.
It can happen to anyone. About 15% of the time, the stroke can happen to young people, meaning age less than 55. You see that a lot in Hawaii, actually. Okay,
but for other people, you say similar to heart disease, heart attack, it usually targets somebody who suffers from a cardiovascular disease going in.
Yeah.
It's just not normally a purely healthy person.
That's mostly true. So most of the time, the stroke patients and heart patients have similar risk factors, so high blood pressure, diabetes, high cholesterol, and so on. So that can make people at high risk for both stroke and heart attack. But young people can also have stroke for other atypical reasons, and anyone can have a stroke, people in their 20s and 30s.
So basically, a stroke is a blood clot traveling to the brain.
Right. Well, most stroke is that clot going into the brain and causing a blockage. So that part of the brain doesn't get enough blood flow and oxygen and starts to get a permanent damage. And we lose about 2 million brain cells every minute during the stroke.
Okay, that brings me to my next question, because somebody suffers a stroke. I know there's some incredible protocol and medical advancements that if a patient is brought into an ER, you see the right people within 10 to 15 minutes, the chances for recovery are significantly greater. Every minute you said 2 million brain cells lost. So is the best thing, if possible, to get that patient into a car and not even wait for an ambulance? What should somebody do if there was somebody who suffers a stroke?
The most important thing is to call 911 and get the ambulance there. And even if the drive time is the same, the ambulance crew can call the stroke-ready hospital and get them alerted, so the stroke team can be ready. So as soon as the patient arrives to the ER, we can start the treatment, and then everything gets so much faster. If they drive into the hospital, there could be a significant delay before the stroke team sees the patient and gets the treatment. That could be a difference of an hour sometimes.
Okay, well, I want to talk about the warning signs. So here we go. It's FAST. Want you to go through this, and what should we, if we are with somebody, we're out to dinner with at a family gathering and you see something odd, this is what we should be looking for. Kind of walk us through this.
Yes, if someone's having a facial droop, so one side of the face, especially around the mouth area, starts to get droopy, and then ask them to smile into the asymmetry, that's a warning sign. If arm starts to drift down, so ask the person to raise the arms, both arms, and one starts to drift off, that's a warning sign. And speech, if the speech is slurred or incomprehensible speech, not making any sense, that's a warning sign. So most of the stroke, you have one of those three elements. If you have all three, that's a high risk warning sign. And T stands for time, again, emphasizing that we lose about 2 million brain cells every minute, and you just have to call 911 immediately. And even if the symptoms are mild, it could become very severe in a matter of minutes.
Okay. Finally, what can we do to prevent becoming a stroke victim or heart attack victim? It just goes back to being healthy.
Yeah, healthy lifestyle, check your blood pressure, making sure your regular screening gets done, diabetes, cholesterol, and so on, and exercise. And yeah, healthy lifestyle.
Perfect. Appreciate the tips, Doc. Thank you.